Good afternoon and aloha. Welcome to International Women's Day 2021 Honolulu. My name is Gabby Harold and I'm a consul at the Australian Consulate-General in Honolulu, and I will be your MC for this event. International Women's Day is a day for us to recognise how far we've come towards gender equality and how far we have left to go. It's a time to celebrate the achievements of women, whether social, political, economic or cultural. The global theme for International Women's Day 2021 is Women in Leadership, Achieving an Equal Future in a COVID-19 World. The theme celebrates the tremendous efforts by women and girls around the world in shaping a more equal future and recovery from the COVID-19 pandemic. We've taken the global theme and wanted to put a local spin on this theme and provide an opportunity to hear from some of our local women leaders in the health sector and to honour and celebrate frontline medical workers. Before we meet our panellists today, I'd like to introduce our host for this event, Australian Consul-General to Honolulu, Ambassador Jane Hardy, and State of Hawaii First Lady, Mrs. Dawn Amano-Ige. Ambassador Hardy commenced her role as Australian Consul-General in January 2018 and has previously served as Australia's Ambassador to Spain, Andorra and Equatorial Guinea, and was counsellor in Australia's embassies in Washington and Seoul. Prior to joining DFAT, Ambassador Hardy worked in the NGO, business and university sectors. She's published author of books and journals on Australian Indigenous art and analysis of overseas aid programs. Mrs. Dawn Amano-Ige became the First Lady of Hawaii in December 2014. Professionally, Mrs. Ige is an educator, as we heard last year when we came together and discussed the importance of promoting women and girls in STEM. Science, technology, engineering and math. Mrs. Ige has been a great friend and supporter of our International Women's Day events, and we are pleased she is able to join us again today. COVID-19 has changed the way we do many things, and in 2021 we will celebrate International Women's Day a little differently, and we hope we will be able to meet in person again soon. On International Women's Day, we celebrate all women in all their diversities. We embrace their facets and intersections of faith, race, ethnicity, gender or sexual identity or disability. We celebrate those who came before us, who stand beside us now, and those who will come after. Women stand at the front lines of the COVID-19 crisis as healthcare workers, caregivers, innovators, community organisers, and as some of the most exemplary and effective national leaders in combating the pandemic. The crisis has highlighted both the centrality of their contributions and the disproportionate burdens that women carry. It is my pleasure to introduce our guest panellists today. Dr. Elizabeth Char is the Director of the State of Hawaii Department of Health and has been in this role since September 2020. Dr. Char is an emergency physician and has a special interest in medical preparation and training for homeland security and mass gathering events. Much of her work focuses on EMS and first responder systems of care, providing medical oversight and for many of these agencies. Dr. Jill Hoggard-Green is President and Chief Executive Officer of the Queen's Health Systems and was appointed in September 2019. Dr. Hoggard-Green is a registered nurse whose career includes work with the oncology and bone marrow transplant units at a Level 1 trauma facility and at leading hospitals, ambulatory and home health services in Alaska, Washington and Oregon. Dr. Hoggard-Green will be joined by a practitioner health worker today from our Queen's team. Royal Australian Air Force Wing Commander Dr. Joleen Darby is a Senior Aviation Medical Officer. She works at the Office of the Command Surgeon General here at PACAF. Prior to her posting in Honolulu, Wing Commander Darby held the position of Commanding Officer of the Royal Australian Air Force Institute of Aviation Medicine. Wing Commander Darby has deployed on numerous exercises, operations and aeromedical evacuation missions. She was awarded a Conspicuous Service Cross for her outstanding provision of medical care as the sole medical provider managing a large-scale mass casualty situation whilst in a remote and austere environment during operations in 2009. We will hear from these amazing ladies shortly. I encourage you all to ask questions via the chat function for our panellists and that I will ask during the Q&A portion of our event. Without further ado, I'd like to hand over to Ambassador Hardy for her welcoming remarks.
Aloha. We're honoured to be co-hosting our celebration of International Women's Day once again with our dear friend and Hawaii First Lady Dawn Amano-Ige, and our distinguished panel and our audience. As my colleague Gabby Harold has said, International Women's Day has been celebrated for more than a century. The first International Women's Day gathering in 1911 was a year in which most of the world's women didn't have the vote, and they didn't have many other things that we've come to take for granted, such as access to higher education and entry into heavily male-dominated professions, including medicine and health. However, at that time, Australia in 1918 had nearly 100 women who held medical degrees, and some of them went on to make their names through the very dark days of World War I and the 1918 Spanish flu epidemic. The simple truth was the world needed their skills. They had many barriers. For example, the Joint Allied Command in Europe decreed that women doctors were not allowed to serve, although they allowed our intrepid nurses. But the world was desperate for their valuable skills and their knowledge and their training. So 100 years on, we're here again in the midst of an almost unparalleled pandemic. Thankfully, though, not a world war. Unlike 100 years ago, around the world, women scientists, doctors, epidemiologists, and our highly skilled nurses and many other frontline workers are visible and valued for their role in this fight. The leaders in this field who are with us today have in the past 12 months had a unique experience and put their skills to the utmost test, the likes of which may never occur again in our lifetimes. We're so proud of them and their sisters in other parts of the world. I take this opportunity to acknowledge leading Australians, all of them women, who have kept our country safe this past year. There are chief health officers in 5 of our 8 states, in Queensland, Northern Territory, South Australia, Tasmania, the Australian Capital Territory, and New South Wales. There are chief nurses and CEOs of our state hospitals in many states, and I would also note that many of our health state departments' heads of psychiatry are women. Mental health has been a significant focus of the COVID era. I can name them later if you like. Dr. Jeanette Young, Sarah Watson, Nicholas Spurrier, and Professor Anne-Marie Keenan, Kerry Chant, Jodie Glading, and Karen Coleman from all of these states and territories. We also have numerous Australian scientists and medical scientists who have won Nobel Prizes and are dominant in the world of international health today, including Raina McIntyre. Professor Raina McIntyre at the Kirby Institute at the University of New South Wales is now a world-leading epidemiologist. She also works on other things: vaccinology, bioterrorism prevention, mathematical modelling, genetic epidemiology, public health and clinical trials in infectious diseases. So you can see why she and her fantastic team in Sydney are world leading. We've had others as well. Professor Elizabeth Blackburn won the Nobel Prize in Medicine in 2009 for genetics and microbiology. And of course, we have household names in Australia, Dr. Fiona Stanley, who is a groundbreaking epidemiologist and director of the Department of Paediatrics at the University of WA, Western Australia, and Dr. Tracy Westerman, a proud Nyamal woman from the Pilbara region, a very remote region of the northwest of Western Australia. She's a recognised world leader in Aboriginal mental health. Now, turning to our First Lady, Dawn Amano-Ige. Dawn, there is such a positive story to tell here in Hawaii. Despite our fears and our current hardships, we have a lot to be thankful for and a lot to continue to plan for. But I'd love to hear from you next. Over to you, Dawn.
Aloha and mahalo to Ambassador Jane Hardy, Consul-General of Australia, for co-hosting International Women's Day. It is an event, I consider it an annual tradition that I look forward to every year. But this year we are celebrating today a little differently because 1 year ago, COVID-19 descended on our shores. COVID disrupted every aspect of our daily life, the way we work, live, learn, and interact with each other. But we quickly had to adapt by turning to technology as we are today, understanding science, and following health practices so that we could work as safely as possible. 1 year ago, states also began issuing lockdown orders as a way to combat the spread of the disease. However, the impact of shutdowns has not been felt equally. I have to share, across the United States, women lost more than 5 million jobs, nearly 1 million more job losses than men. And in December alone, women accounted for 100% of job losses in our country. Here in Hawaii, women suffered job losses in industries like retail, food services, hospitality, and social care services. When schools and daycares closed, most of the household responsibilities fell on women. And it should come as no surprise that almost 80% of frontline healthcare workers and most essential workers are women. So going into 2020, we cannot continue to ignore the tremendous contributions of women to economic, health, and social life. The pandemic has upended life as we saw it, but in Hawaii, we have strived to overcome many challenges. In fact, Hawaii currently has the lowest COVID infection and mortality rate per capita in the country. Many women leaders here in Hawaii have worked tirelessly to design and implement our state's COVID response. And we're so excited to hear from some of them today. Dr. Libby Char, Kathy Ross, Dr. Joe Green, Charlene Tanabe-Pang, and Dr. Joleen Darby. The pandemic also emphasized that we are globally interconnected, and the only way to combat this virus is through worldwide partnerships. While today's International Women's Day does look different, it is a gathering that is important because we all here as women leaders in Hawaii, Australia, and around the world must join together to lead the effort towards recovery, healing, and rebuilding from the losses of this pandemic. I know that we can do this together. Thank you and aloha.
Thank you so much, Dawn. It's wonderful to see you again, and inspiring words. And you say we have, as you say, we have a lot to be thankful for to be here in Hawaii. Now let's ask our three panelists and some of their staff to introduce themselves. First of all, I'll turn to Dr. Libby Char and Ms. Kathy Ross. Over to you, Dr. Char.
Good morning, and thank you for allowing us to participate. It's an honor to be part of this International Women's Day. I've been the Director of Health since September, and with me today is Ms. Kathy Ross, and she is the Deputy Director of the Department of Health, and she is just an incredible, amazing person. She is one of the hardest working people I know, just a creative problem solver and a tremendous part of our Department of Health team.
Thank you, Dr. Char. And now over to Jill Hoggard Green. Over to you, Dr. Green.
Aloha. It is such a privilege to be with all of you today. What a distinguished panel, and with you, Madam Ambassador and First Lady. It is a true pleasure and privilege. I am joined by an outstanding registered nurse, Charlene Payne. Charlene has been at the front of our work on COVID, on our COVID-19 unit from the very beginning. And I joined Queens right before the pandemic started. So I look forward to our conversation today and acknowledging all the women that leaned in together and created a safer community here, both in Hawaii, but across the world.
Thank you very much, Dr. Green and Charlene Pang. Yes, I should have mentioned nursing is such an important part of this story. And we have many heads of nursing in our states in Australia as well. And finally, Wing Commander Dr. Jo Darby. Jo, would you introduce yourself?
Yeah, good morning all. I was just reflecting as I was looking through the video of just what the last 12 months have been. I arrived around about February 2020 into the PACAF Surgeon General's office on an exchange posting for 3 years. And I recall the wonderful event of Women's Day 2020 and just pause to reflect the last 12 months, as we've all mentioned, in terms of how that's changed. I'm very pleased to see the amount of photos in the introductory videos, and in particular of Air Force medics leading the way in terms of obviously Australian response in COVID. And I think that's testament in terms of both the military and civilian women leaders that we've had in this pandemic response, and very humbled to be part of the group today. And thank you again for the invitation.
Thank you, Jo, and the panelists. Now, I'll start the questioning, and after I open with my question, I'll get our MC, Gabby Harold, to read out to collect questions from you all. Please use the function on your Zoom screen to type in your questions on the Q&A panel. Thank you very much. And while we wait for questions to come in, let me start the ball rolling, because I wanted to ask Dawn. Dawn, I've been here 3.5 years and I've known you for all that time. And I realize you've had a bird's eye view of Hawaii for the past 6 years. You've been our First Lady for all of that time. And in that time, you've not only had a bird's eye view, but you've had a lot of community outreach that I've seen on the Hawaiian media. So this past year, what have you observed about the people of Hawaii and their ability to cope with this devastating pandemic? And particularly, can you think of any key lessons, either for yourself or for all of us, that you would identify from what you've observed of the people of Hawaii and their response to the pandemic this past year?
Thank you, Ambassador. You know, it has been a pleasure working with you in the past few years and working together on many events. Over the past 6 years as First Lady, it has been a pleasure and honor to be here and to serve as First Lady. What you notice first and foremost about the people of Hawaii in a crisis or in a situation is everyone stops to work together. That's, I think, first and foremost. And out of that working together, there is a sense of resiliency, creativity, and the attitude of we're going to get through this, and we're going to get through this together. I think attitude is the first thing that you see, because these attitudes gives you hope. I've heard people from the Waianae Coast Comprehensive Center, for example, they had to look at food distribution, and they immediately looked at the community, the needs, and how they can provide for the community in a way that is accessible and fair to everyone. So it's just heartwarming to hear those stories and to see those stories. And you asked me what key lesson it is for myself. It is for myself to be able to be flexible and not, so often we get caught into doing things the same way. We get into a routine. But things happen in life that really forces us to adjust, whether it be a pandemic or something personal. And I think in that sense, we really need to work to be resilient, and we need to count on each other because we can't do it ourselves. I think one of the things I observed also in watching the governor, he had to pull many people, many from all industry leaders throughout the state to come together to solve different aspects of the pandemic.
Yes, well, that's really inspiring. Thank you very much, Dawn. Now, I believe we've got some questions ready. So I think, Dawn, are you going to ask the next question, please?
So the next question I have is to Dr. Libby Char. And the question is, with several variants of the virus currently around the world, there has been much discussion about having a booster or updated vaccine in the future. Which would you say is the more realistic option?
That's a tough question. I'm hearing of two investigations right now. One is to boost the amount of antibodies that our body makes against the virus. So certainly that would be an option if it's something where your immunity wanes over time. The second is a booster, if you will, so that our body can recognize a much wider audience of COVID virus, especially having the other variants now, so that we would do a better job of recognizing all those different variants. It's such a new disease and such a new vaccine that I don't think we really know how long we're going to have this immunity. I would not be surprised at all if it's a matter of getting, like your flu shot, where it kind of mutates a little bit every year. So getting a shot every year or something along those lines, I wouldn't be surprised at all if that's what we end up seeing.
Right, that's, sorry.
Go ahead. Dr. Char, it is a very complex virus, and it is just amazing the amount of work that went into it to come to this point where we do have a vaccine for so many people now. Thank you. Back to you, Ambassador.
Indeed, the vaccine has given us a light at the end of this dreadful tunnel, and we're well ahead of the game here in Hawaii, thank goodness. Now I'll just ask a question that's been posed for Dr. Green. Jill, you were only on the board and as CEO of the Queen's Health System for a few months before COVID hit. Talk about that transition, please, for you and how you were able to work with your team to pivot, rapidly responding to this pandemic right at the front line.
Thank you for that wonderful question, Jane. Yes, I'd just been on the ground for about 3 months when we started learning about the virus, and about 6 months when we actually had the first patient in our state. What was really amazing to me is, first, Queen's Health System was created in 1859 by Queen Emma and King Kamehameha IV based on seeing their people die of infectious diseases. So for everyone at Queen's, it took us back to our core, which is we're here to partner and improve the health and well-being of Native Hawaiians and everyone here. And to the First Lady's wonderful comments, Don, thank you. What I did see, and I've lived in multiple states, is everyone leaned in. Both our governmental leaders, our governor, our lieutenant governor, our Dr. Char, all of our health providers across the state, we started working as one, and particularly our frontline. So for me, it was a real privilege. You'll get to hear from Charlene later. We have individuals that are tremendously compassionate, believe in this is protecting both their patients, their community, and their ohana, their family. And so for us, we immediately leaned in. We all knew we didn't know what to do, that we knew about infectious diseases, but we were all very humble that we did not know about coronavirus. So we moved into what I'll call a HIC structure, where we set up our teams every day. They were meeting every day, morning and night, working on innovating new processes, new protocols, evaluating them rapidly. And I saw a community of caregivers, and we have about 8,000 caregivers and 2,000 physicians and providers, all leaning in and everyone helping. The environmental service technicians, the facility teams, the clinicians that had the privilege of being at the bedside, all did it. So I saw tremendous innovation. We connected across the world. One of the things, we're here a couple of hours, a difference from the continent. Many of us were calling colleagues across the United States, and across the world, studying and learning together and sharing protocols across the world. So I was personally touched and humbled every day. Our caregivers came in scared. They didn't know about this disease. They didn't know what it would mean to their own health or their family's health, but they demonstrated incredible courage and came in every day and innovated and created a safe environment. It was very humbling to see.
Right. Well, it's great to have Charlene here, who is one of those intrepid nurses. Do you have anything to add right at this moment, Charlene, before we go on to the next question?
No, I think Jill, said much of, what has been going on, to combat, this virus altogether. Yeah.
Thank you. Okay, well, back to the First Lady. I think we have another question.
Yes, and this question is to Kathy Ross. How can gender equity, gender equality in public health positively impact the wider community in Hawaii?
Hi, thank you for that question. One of the things that I really love about public health is that equality and equity are at the core of what we do. So as it relates to gender equality and gender equity, we don't just support it in words, we support it in our programs that we have in-house in the Department of Health and the programs that we fund out in our communities. And so some examples would be perinatal support and also some prevention and screening for women who may not necessarily seek out these services. We want to be proactive and assure them the best quality of health and healthcare that they can get. We also provide a bunch of services to people regardless of their gender identity. And we do that through a lot of the hard work and our very diligent and dedicated staff at our community health centers. So you may know some of our health centers, like at the Diamond Heads Health Center, our Windward Health Center, and also on our neighbor islands, that anybody that walks in, we make sure that we take care of them. In essence, supporting a robust public health system really supports gender equality and gender equity. And one thing I'd like to note is that in the Department of Health, we have just about 2,600 employees. About 2/3 of them are female. And what's even more remarkable is that in our leadership positions, we really reflect that balance of gender equity. So in our leadership team, we have 3 out of the 5 executives that are female across our department in various leadership positions. We also see that kind of equal distribution. So it's a really great thing in our public health system. Thank you.
Thank you, Kathy. I like your point of good health means gender equity, and I think gender equity also means good health. So I think they all go hand in hand. Ambassador, to you.
Okay, well, I was really focused on Charlene because I have a sister who's a registered nurse as well and often works in emergency and disaster response. Jill spoke about what you all experienced there at Queen's at the beginning of the pandemic, and we're now 12 months into it. So Charlene, could I ask you to comment on the challenges you've seen in 12 months on, both personal and professional? How are you delivering frontline healthcare now, 12 months into the pandemic?
Yes. When this all started, it was the most scariest thing that, any nurse had to walk into. But like Joe was saying, there was just this immense collaboration of all sorts of people and departments working together to, just deliver the safest possible care that we could for, both the patients and the staff at the bedside. So, it was, a lot of changes that we had to make to our workflows. It wasn't just about walking into a patient's room. You had to stop, and really look at yourself and everything that you were doing before you walked into the room, which made it difficult because you had to think about, the safety of yourself, not just of the patient, donning PPE every day, doffing, taking off our PPEs. We constantly have to be thinking everything through every step of the way. So that's just, been, I think, one of the biggest challenges is having to step into that every single day, doing that day in and day out. And also, these patients, they're really sick and, they're alone, in this most difficult time of their life, with COVID, and they have no family, they're alone. And so we actually have to bridge, that for them. We had to be innovative and, use all different types of technology to, bring, the patient and the family together. And so also that was very challenging because aside just from the nursing skills, you're also having to use this new technology, the WebEx, and like Zoom, and just incorporate all of that together in your care. So yeah, there's been a lot of challenges. I just, the entire team that I've been working with has been amazing. They're like battling this invisible war that you can't see for over a year, and it's just been really tiring. But everyone is, they're so strong and resilient, and I just want to, thank them, for being a part of this journey to get where we are today. I'm so thankful, all the efforts that we have come along, in creating all of these vaccination clinics around the state, getting everyone vaccinated. And it's just wonderful because I don't want to continue to have to, be at the bedside watching this, for the rest of, my career. I know it's not going to completely go away, but we're getting there. And I'm very hopeful, that we'll be able to see a sense of normalcy in our lives.
Well, mahalo to you, Charlene, and all your colleagues in the nursing and other frontline professions. I'll never forget images from other parts of the United States on the television over these long, long months, and of nurses providing the very last contact, human contact with people who were really at the end of their lives. I mean, it was just absolutely striking and heartrending, and it really pushed home the significance of how this pandemic has really impacted on all of us, regardless of who we are. So thank you. And I'll turn back to Dawn now for the next question.
Thank you. And I'd like to also echo my appreciation to all the frontline workers and nurses caring for the patients. The stories that you share, it's just, we often have, during the pandemic, we've all talked about having to adjust. But when you're caring for patients, you're having to adjust for yourself as well as helping patients along technically, clinically, and maybe most importantly, emotionally, because as you said, they're alone. So thank you so much for what you do and how you've helped all of us come through this.
Thank you.
My next question is to Dr. Darby. You've done a lot of training for various medical scenarios during the COVID-19 pandemic. What do you see as some of the challenges in providing a humanitarian disaster response going forward?
Mahalo for the question, and I think that's actually something I've recently experienced on a exercise I did in Guam, which was a trilateral exercise between America, Australia, and Japan. And we actually basically did a training for that exact scenario where a sort of an unnamed Pacific island had a significant typhoon. And then we would have to provide or assistance with that country in medical assistance after a devastating natural disaster like a typhoon, and how you would manage that in the COVID threat environment. And the answer is it's actually really challenging. And, I would really struggle to do that real time. Listening to Dr. Green and Charlene, who provided, excellent insights in terms of the challenges of managing COVID here in Hawaii, I think we could all appreciate how difficult that would be after a significant natural disaster where, logistics, infrastructure, power, refrigeration, PPE supplies would all be quite significantly impacted, not to mention the significant emotional and mental health toll of what they would have on the population. And just personally, from exercising that, and we sort of set up a field hospital, was that it's actually really challenging wearing full PPE in the heat and humidity. I know I was kind of affected by heat and heat illness. You just don't drink as much, and little things, kind of the climatic environment. So, I really hope that we don't have to do that in real time. And I think that's even more impetus to try and get the vaccine out into those regions and into those countries. And, Ambassador Hardy, I don't know if you have time later on, but I'd be very interested in sort of getting Australian government's response to some of those sort of Pacific Island vaccine rollouts, because I think that's something that, as countries, we do have that responsibility to ensure that we get the vaccine rollout into some of those regions. But yes, great question. And I think it would be incredibly challenging during that real time.
Thank you so much. I cannot imagine a disaster on top of a pandemic, and to be able to just help so many people with so many logistical issues, medical issues, and just making it work and helping them to survive. So thank you so much for what you do. It's incredible. Ambassador.
Okay, so I've got another question for Dr. Char, and I think this is one that everybody is asking. So we'll probably have a few of this nature. How is Hawaii doing with vaccination rollout, and what are, some of the biggest challenges in the vaccine program? Dr. Char.
Thank you, Ambassador Hardy. When we first started planning for the vaccination, it seemed to me as though it would be really straightforward, right? You receive some vaccines and set up some locations and just give people a bunch of shots. How hard can it be? Being in the middle of it now, I have just a profound appreciation for the complexity and really the challenges of it. I think we're doing well overall. Like anything, there's always room for improvement, no matter what you're doing. But I think overall we're doing well. We are getting vaccines in and we're getting it into people. There are different kinds of vaccines. There are different nuances. There are different challenges with each of them, different settings. And that's all increased the complexity of it. But I think overall we're doing well. The biggest challenge right now to us is just the amount of vaccine that we receive. And so while I'm very glad that we are receiving a progressive increase in allocations, it's still frustrating because there's so many people that want the vaccine, for which we are very, very happy. But just trying to get more vaccine so that we can administer it to people, that's probably our biggest challenge right now. I think overall we're heading in the right direction.
It's, from what I observed, going very smoothly. I've seen the people going into Blaisdell and Pier 2. It's been such a difficult time to live in a remote area, but Hawaii seems to have planned well and gotten on top of the vaccine rollout. Joe asked me to comment briefly on the Pacific rollout of vaccines, which I can do now, and if there's more detail later that anyone wants, we can provide it. But Australia's COVID response is not just nationally, but it's to our first island chain and beyond. So our first island chain is the archipelagos north and east of our mainland. We ourselves have 8,000 islands, but there are thousands of others. Of course, the biggest of these is Papua New Guinea and Irian Jaya, and then Solomon Islands and so on. If you look at the map, right across the South and Southwest Pacific. So Partnerships for Recovery is a big program that we're rolling out, and it's concentrated in our neighborhood, Oceania, Timor-Leste, and Indonesia. So there's a $4 billion ODA, that's official aid budget, will be central to delivering this Partnerships for Recovery. Of that, 1.44 billion is for Oceania, the Pacific Island countries. And that will be supplemented by another $300 million. And we're working with our partners in the Pacific to deliver vaccines as part of this as well. And we've contributed $80 million to the COVAX Facility Advanced Market Commitment. So some of you may have heard of this program in the media. There's a lot of commentary on countries, richer countries having huge amounts of vaccines on order and the poorer countries not. Well, we are working to mitigate that scenario in our neighbourhood because, frankly, we're all in it together. If we don't have people in Papua New Guinea, the Solomon Islands and so on being vaccinated, then we're all at risk. And this is the very principle behind our rollout. Those countries, I just quickly explain, will be doing their own rollout with our assistance and our material support, both in money for vaccines and in supplying some of the vaccines themselves and getting them to remote parts of those countries. Perhaps I'll leave it at that, and we can go back to some of the Q&A. Dawn, I believe you've got another question.
Yes, the question is for Dr. Green. During this pandemic, hold on, I will have to read this. I'm going to have to admit my teleprompter is a little off, so here we go. During this pandemic, you've often spoken about innovation on the part of your caregivers. How do you springboard off that innovation to improve the overall health and well-being of our community over the next 10 years and beyond?
What a wonderful question, First Lady. Thank you. So our teams came together, as we just discussed, across governmental leaders, health systems, and frontline. And what we learned is how to do a rapid process improvement, learn, measure your outcomes, and keep innovating. And we did that hundreds of times. The simplest example is early in the pandemic, we used a lot of telemedicine because we are a rural state, and we have the stroke teams up here in Oahu, and we've done lots of telemedicine across the islands and used that for behavioral health as well. But on average would be doing about 400 telehealth visits a month. In a month, the month following starting the pandemic, we did 14,000 telehealth visits. So fundamentally shifted how you delivered care. What we learned, and it's not just the individual learning, what we learned is we can innovate. We can think differently. What we need to do is keep very focused on the individuals and families that we're serving and design the care in the way that they need it. So as we think about, we have a shortage across the state of primary care. We're working very hard from an education perspective to recruit and retain the right number of clinicians in our communities, but particularly in our small rural communities, it's very difficult. What we've learned with differing technologies, we can really support those primary care clinicians very differently than we thought even a month ago or 2 months ago or 3 months ago. So for us, we've said the pandemic, we are going to overcome. We're going to get to a point that we can live with the virus and continue to grow and develop and thrive as a community. What we don't ever want to lose is that constant questioning, can this be better? And how could we improve it? So we looked at, during this pandemic, our board, who is an amazing community board, spent over 100 hours in the summer on Zoom calls, not only helping us focus on today's work and COVID, but thinking forward for the next 5 to 10 years. So they started thinking out, what are the aspirational goals that Queens needs to have? What is it that would fundamentally improve? And from that, we developed a whole series of conversations that we're having with our clinicians starting now about how could we be more fundamentally involved in improving health and well-being. We have, Kathy Ross had indicated earlier, those issues with health inequities. We have health inequities in every community across our country, and we have them here. We have gaps in life expectancy that we need to close. So we are thinking about the next 5 to 10 years and how do we collaborate with our public health partners? How do we ensure that our public health infrastructure is in place? How do we create ways to improve health and well-being and reduce the gap? And I'll just use Native Hawaiians. There's almost a decade difference in life expectancy between some individuals and ethnicities on our islands and Native Hawaiians. How can we change that? Which really means we got to partner differently. We need to listen more carefully to the people we serve. And we need to work on fundamentals, which include assuring that moms and keiki or babies are healthy, assuring that education is available to all in effective ways, building our public health infrastructures, and many more. So we're all in for thinking about and working together, utilizing that innovation and humility, because the other thing we all learned during this pandemic is humility and reliance on each other and building strengths within our community is what's most important.
Thank you. And you had mentioned telehealth. I think telehealth is a real opportunity for especially reaching out in the rural areas. I know that when I had a telehealth visit with my doctor, I found that we were more in conversation than a one-to-one visit. And I thought that was really interesting. That's one of the benefits, the more human social benefits of telehealth. We think of all technology, but there's some real aspects of it that is really reassuring to the patient. Thank you. Ambassador?
Yes, so that's very interesting. And First Lady also touched on general economic impacts on women in our society here in Hawaii and around the world. And I think the next question is something that probably my guess comes from an Australian who's keen to come back to Hawaii. Our tourism has dropped off so dramatically. And this is a question for Kathy Ross again. So Kathy, does Hawaii envisage a vaccine passport for travelers?
So as most people know, today CDC released guidance on what people who are fully vaccinated can do and what are the things that they should still maybe not do. And it's really promising, as you know, just to summarize real quickly, it's really promising that they're saying, yes, if you're fully vaccinated, you can have dinner with another household and those members that are fully vaccinated. You know, if that other household is not quite vaccinated yet, you probably still want to adhere to the safe practices that we've all been doing. And in fact, one of my good friends who regularly texts me and calls me asking for advice about for her family and her parents about COVID safe practices, texted me this morning and asked, my parents want to know if they can go and have dinner with their friends who are also fully vaccinated, because they weren't really sure what the CDC requirements really stated. And I said, yes. And she said her mom started jumping for joy because she's so excited that, you know, again, I often am the person that says no to many things that her parents have asked about. And so for them to be able to enjoy a meal with a fully vaccinated family or friends, you know, they were very happy about it. What the CDC guidelines unfortunately doesn't include at this moment in time is saying that, yes, we have a COVID vaccination passport, if you would. That's not in the guidelines today. However, I would like to say that our state is ready. Our state is ready for that day when a vaccination-related passport is ready to go. We have a wonderful Safe Travels Hawaii team that meets several times a week, that we're prepping the PNPs and some of the IT systems to be able to implement anything that the federal government determines can be implemented with, like a vaccination passport. So we're not there yet, but I want to share that we're ready. We're ready to flip the switch when we need to. Thank you.
Thank you so much, Kathy. Gabby and I were just chatting because there's a lot of questions, but I think your answer has covered the range of questions related to that for now. So I'll just quickly hand back to Dawn.
So the next question is to Dr. Char. What prompted the Department of Health to lower the age for vaccination from 75 to 70?
Thank you. So as you know, today is the day where those who are 70 and older are welcome to come and get vaccinated. It had been 75 and above, and we have been watching the data very carefully and watching the vaccination process. And as the uptake of appointments was slowing, and as we were receiving more vaccines, that was enough to say, let's open it up. We want to maintain a really brisk uptake of those vaccine appointments. And we want to make sure that people get vaccinated while at the same time making sure that those who have, the highest risk from this disease have access to it. So we opened it up to 70 and above today. And I imagine in the very near future, we will start opening it a lot further. I think we're sort of right on the tipping point of when we may start getting enough vaccine to move a lot faster. It's been a bit slow thus far, but we're grateful for the vaccine we've received, and we just can't wait to get a bit more so that we can start moving a little bit faster.
So Dr. Char, it is a real supply issue then that really determines which age group gets the vaccine or when you lower the age group.
Absolutely. I mean, we would love to vaccine a lot more people a lot faster. Jill knows very well that at Blaisdell and at Pier 2 and almost statewide, we have the capacity to administer a lot more vaccine today. And it's just a matter of the allocation that we're receiving from the federal government. So we're slowly seeing that on an uptrend right now, and we hope it starts going a lot faster because we're really excited and anxious to get people vaccinated faster.
Thank you. Ambassador?
Thank you. That's fascinating. I want to go back now to look at our leadership in this age. So Jill and Libby and Joe, Kathy, Charlene, you've all shown fantastic leadership. It's like we've all been trying to build a plane as we fly it. I'm sure you'll agree. But Jill, coming back to you, I mean, I realize you said you've got 40 years of nursing experience, and not many hospital CEOs can boast that amount of clinical frontline experience. So how has that experience shaped your approach to leadership?
Thank you for that question. And I am so proud to be a registered nurse. It is a wonderful discipline, and we're surrounded by great team members that are physicians and all sorts of disciplines. But for me, it's been the heart of why I deliver healthcare. Our discipline is based on, if you go back to Florence Nightingale, she was one of the first epidemiologists. She was one of the first statisticians. She saw infectious diseases and started identifying ways to treat them. For me, when it comes down to leadership, and then particularly leadership during this pandemic, I went back to our basics, which are first, healthcare always is done by a team. You need to bring your team together and understand both the science as well as you are caring for people. So your compassion, your ability to bring teams together and help us create things together in a way that we can then assess them and measure them and identify opportunities to improve. That was a constant reminder to me. It also took me back when I was a young child. My sweet mama, who has passed away, and my aunties were both nurses. And they used to take me on home visits back when I still remember when I was 4 years old. If someone was frail in the neighborhood or not well, we would make a casserole and mama would go and visit. And actually she was delivering some nursing care and I got to bring the food. So it taught me the need for community and the need for us to recognize there's so many people that if we bring us together and focus together, we can be able to adjust and create the care that's needed. So I watched that in this community. How many people created food banks? How many created projects to take care of their neighbors? It's an inspiring time, as painful and devastating as this disease is, and it is. The love and compassion that I could see on the island and was brought as a part of being a nurse, it was an amazing time. So hopefully, I also had a lot of time spent with frontline clinicians. I do know that we learn most from our patients, our families, and from the frontline teams. And so they taught me a lot as well, and I learned that as a nurse as well.
That's a fantastic description of what you've experienced in your life and now. And I can see living here in Hawaii, I concur, we've got great warmth of feeling around us and real commitment. It's been so inspiring. Now, I want to turn to Gabby because we've had a whole range of questions come up on the Q&A chat function, and I'll ask our audience to keep the questions coming. Before I turn to Gabby to ask some of the questions that have come up, are there any other comments from our panel members? No? Okay, well, let's go to our audience, our other questions that have come up now. Over to you, Gabby.
Thank you, Ambassador. So we have had a lovely range of questions come through from in our audience there. So the first one I've got here, Laura Davies is asking a question for Wing Commander Darby. So Dr. Darby, Laura wants to know what experiences have you gained from working with the US during COVID that you may not have got from working with Australia during this time, and she also thanks you for your service.
Yeah, look, it's a very interesting question. I think the Australian response to COVID does differ, obviously, from the US response. There's also there's some similarities as well. Even just the vaccine, Australia is getting the AstraZeneca and Pfizer vaccine, slightly different to the vaccines that we have available in the US. So, look, I think the interesting differences that I've observed is obviously the numbers and the case numbers and the scale of obviously COVID response compared to Australia. And it's interesting when I talk to my US colleagues and I talk about Australian public health response or even Australian government response and talking about a city closure of a city the size of Melbourne or Perth for 2 or 3 cases and talking about closing down and shutting down a city kind of for such low numbers. And I think that's sort of been a little bit of the public health response in Australia is to go hard, go early, trying to stop community transmission, in the first instance when there are very low cases. Australia obviously has the advantage of being an island and can control the borders, and hotel quarantine has been a sort of a real sort of significant, I think, reduction in importing cases. But their response has been a little bit different to the US. And I think that contrasts for a variety of reasons in terms of, political and cultural. But, I just can't see an American city kind of shutting down for 2 or 3 cases. But I think, I've been impressed by obviously the Hawaii response, and I differ in terms of the response and how early and quickly we adopted the mask mandate, and how that's been actually quite well received in Hawaii life. and I sort of compare and contrast back to my family and friends in Australia who kind of still aren't used to wearing masks, and it's just become norm for us here in Hawaii and Hawaii, and we don't really think anything of it for a lot of people. So I think they're probably my big differences. I think we've got probably a lot to learn on both sides, and I think Australia obviously has different challenges and different kind of COVID response, which might not be applicable kind of to the US. And as my boss always says, I think the next sort of 5 to 10 years, people will be doing PhDs and research into respective different countries and states' response. And I think that will be kind of where we'll get a lot of the lessons learned and wash out in terms of, how it applies. And I think that's probably my key point, is that you have to do a response based on the local region, and what would work and what might work in one area might not be applicable. And it needs to be tailored to the local population in terms of how that would be response.
Great, thanks, Jo. So next I'd like to turn to Charlene. So we have a listener who would really like to hear about your career. What's brought you to where you are today? So did you find nursing, or did nursing find you?
Thank you for the question. So actually, I've been a nurse at Queen's for over 13 years. And funny you should ask that, because I've actually started where I am now. So I never really moved out of our infectious disease and respiratory unit. And I mean, I just love it. I love the people there. I like this organization. Everyone, it's just a great team to be around. And I'm just glad that, I am on this unit and working with the people that I do, because I mean, this COVID war, you should say, it just took so much ideas and people to get through every day, basically. I mean, every day is a new day. It brings on different challenges, and everyone has great ideas. And I mean, going back to Jill, I mean, she talked about, what it took. And I just want to commend Jill, because she actually came back to the unit, routinely to check up on her staff on our COVID unit, to just listen to the staff. And that was just really great. I mean, the staff just appreciated, her stepping down to step onto these units to really listen and, provide what we needed. So I'm still on Tower 9 Diamond Head working on the infectious disease unit, and, hopefully I can continue to carry that team. I'm one of the charge nurses there. So thank you.
Thank you, Charlene. Now, I do want to acknowledge it is 1 o'clock. We have had a lot of questions come in, so maybe we can get 1 or 2 more, and then what we don't answer, we might be able to put up on our Facebook page when we post the video as well.
Is it all right with all of our panelists if you spend a few more minutes with us, or do you have some hard deadlines? You can stay, and the First Lady, lovely. Okay.
Thank you. And it's great to see questions coming in from some people that we see regularly attending our events, so that is lovely. One here from Lauren Moriarty, and this goes to any or all of the panellists who feel they want to answer, and I think we've had part of this answer already. But what are some of the enduring changes to the healthcare system that you might see emerging post-pandemic? For example, what changes might there be in scope of practice for nurse practitioners or physician assistants, or licensing for people from other jurisdictions coming to Hawaii? So maybe that one might be a good one for either Libby or Jill. I know, Jill, you talked about the shortage of healthcare workers as well.
Libby, you want me to give a first go at that one?
Sure, go ahead.
Great. there are a lot of changes that we have learned. Again, care is delivered as a team. So as you talk about nurse practitioners, APRNs, PAs, physicians assistants, we believe in a team. We need clinicians in a variety of roles in the community as well as in our hospitals. So we're all leaning in on how can we educate more, how can we graduate more, and how can we have more clinicians that will choose to live and practice in the islands. How do we extend their work with technologies that allow them to care for the right number of patients at any given time? We are working very hard, when you think about what can transform, we recognize the need for public health infrastructure. So we're wanting to pivot and say, how do we support in a broader way, working together with public health? There are many, many different ways that we are thinking about how we need to do care differently and allow virtual care to be even much more ubiquitous than it is today. Dr. Char?
I wholeheartedly agree with what Jill's saying. And I think, you know, to step back and look at it from a more macro perspective, I think the public health side of things is really coming to the forefront. My background is not in public health. My background is as an emergency medicine physician. And I am learning daily from people like Kathy Ross that really are the experts in public health. Sarah Kemball is another example. There are a lot of women out there who are very knowledgeable and really are experts and have devoted their careers to public health. When public health is functioning well, it's invisible. You know, we don't think about turning on our spigot and getting fresh water out of there. We don't think about our food systems and our water and our environment and any of that. We just take it for granted. And I think the risk is that public health, because it's invisible when it's functioning well, if there's not a, you know, if there's no acute event going on, it gets pushed to the side, and I don't think it gets as much support as it should in normal times. Because of the pandemic, of course, the Department of Health is thrust into the forefront, as are the healthcare systems. You know, we count on our healthcare systems being there. We don't really think about it that much, but when you need it, you sure hope it's there, and you sure hope it's a nice, robust system. And so I'm hoping that one thing coming out of this pandemic will be that at least there's a recognition and an appreciation truly for what a healthcare system needs to be and for what public health needs to be. And I hope that that infrastructure is supported beyond the pandemic so that when the next event occurs, not if, but when the next event occurs, we are better poised to meet that challenge immediately and head on. And that would be my plea and also my hope.
Great, thank you. Just sort of changing topics slightly, there's a few questions around gender-based violence, and given International Women's Day, I'd be remiss if we didn't touch base with this. And it's around how we can bring more awareness to gender-based violence in our communities to address it. But specifically, and this one is from Monica Herrera, who works in the Office of Women, Peace and Security at US Indo-Pacific Command. Basically, given the well-documented shadow pandemic of gender-based violence associated with COVID-19, and this is to any of the panelists who feel they would like to answer, what are your experiences in providing necessary care and support to gender-based violence survivors during the pandemic?
That sounds like a question for Kathy Ross.
Hi, everyone. You know, I'm so grateful that question was raised during this session today, because from the very beginning of the pandemic, when a lockdown was being considered, that is one of the things that we discussed as a team, as a public health team, knowing that when a lockdown was going to be implemented, what it meant for people to be able to seek safety, seek shelter, and seek services. The pandemic, if there is a good time for a pandemic, in Hawaii, this might have been the right time for a pandemic, because our department had already begun implementing what is now called the Hawaii Cares program. It was formerly the crisis hotline that many people might be familiar with. So what we began doing several years ago under the leadership of Deputy Director Eddie Mercero is making programs that used to be in separate silos, bringing them together to provide more robust and comprehensive services. So people didn't have to wonder, if I'm experiencing gender-based violence, do I go to this program or that program or this other program? It is essentially like a no wrong door approach where people can call. So on Oahu, I'll just share it if you want to share this with your friends and family and your network. On Oahu, if you call 832-3100, and toll free, we have 1-800-753-6879. We also have a website, it's HICARES, HICERES.hawaii.gov. This is the Department of Health and the public health response to assuring that people are not going to be left without services. It may look differently, but the nice thing is that we have 24/7 availability to services, to people to call. We have mobile teams that can go out and support people as it relates to COVID and isolating and quarantining. If people are in a situation that they don't feel that they can safely do that where they currently reside, we have isolation and quarantine facilities across the state that we can safely provide at no cost to our residents. And also the wraparound services that go with that. So not just a place to safely isolate or quarantine during this pandemic, but the food and the counseling and any other behavioral health services that you need. We offer that through Hawaii Cares. So again, not that a pandemic is ever good, but I'm really glad that the department has put this program together ahead of the pandemic so we can continue to offer services. Thank you.
Great, thank you so much for that, Kathy. So along with that, I think the other big issue that people are asking questions on is around mental, physical and emotional impacts, I guess, during the pandemic. In particular, especially for our essential medical workers and nurses who are directly affected, but also, I guess, the people who've been affected with lockdown or have lost jobs or things like that. So, and they're two very different sides of the coin, I understand, the one from the unemployment versus what our healthcare workers are facing. But grateful if we could just talk about maybe what services or how we're supporting both our frontline workers with the emotional and the physical and the mental aspects, as well as, services for people who've lost their jobs, who are struggling. Thank you. So I'm not sure, Kathy, if this sits back into your patch or whether this is Libby.
Dr. Char, go ahead.
Go ahead, Kathy.
Okay, well, sorry to get on my soapbox. Public health, it's just part of me. It's in my blood. And so what I'm grateful for is this pandemic allows us to talk about a variety of the public health issues that we regularly deal with. And so mental health, behavioral health, all of those kinds of things are critical to our ongoing support, not just for the general public, but also for our staff. We know that, like Dr. Char was saying, public health workers and the work of public health is largely invisible. If people remember, not that long ago, last summer, there was a lot of attention around contact tracers and disease investigators, and they were bearing the brunt, the public face of responding to COVID positive individuals. And they do such a great job, and they're so brave, and they're just amazing at building trust with those that are COVID positive, that they start to hear this day in and day out. And I think with a lot of other professions that deal with crisis situations, not often taking enough time for self-care and seeking additional support, and just kind of that suck it up kind of feeling that we need to do when we're in crisis mode. And so we did offer additional support services to our staff on an informal basis. We were able to make and offer more formal supports when it was needed. And it's something that we continue to do. Again, I'll just promote the Hawaii Cares program, which it doesn't matter what issue you're dealing with. If you feel like you're in a place that you need someone to talk with, whether it's a big crisis or a little crisis, our Hawaii Cares program is available for our whole state. And we would really love people to know that it's there and to share it with coworkers, friends, family, the general public. We're here to support the public. Dr. Char.
I think, the biggest thing for each of us to remember is just to reach out and to ask our coworkers and our colleagues how they're doing. And I think that's probably the very first step, that it's okay to talk about these things. I think oftentimes there's too much, it's not something we talk about, or there's an element of shame or something. And I think, God, who wouldn't understand the circumstances that we're all in and the fatigue? And I mean, Charlene, I'm sure you've had nurses on your floor that just day in and day out, and they show up, they don't call in sick, they work the overtime, they're there. If there's a puka in their schedule, they fill it. How can you not be fatigued by that, as well as everything you're seeing and you're dealing with? So I think number one is just that we recognize it, and that we say it's okay. It's okay to say, hey, I'm really fried, or I'm tired, or I'm getting depressed, or whatever the case may be, and to seek help. I think that would be my number one plea. I'm sure Queens has I know Queens has several programs and really is paying attention to that.
Dr. you said it just perfectly. We see the second wave of COVID, it's the mental and emotional and spiritual impact that it's having on individuals. And particularly for caregivers who every day have been putting their all into taking care of the next patient. You can get to a point where you push those emotions aside and just keep doing the work that you need to do to take care of and save their lives. When it actually decreases, and we saw this after the first surge, we saw an increase as the numbers went down, anxiety, anger, pain went up, because folks are really working through what that really meant. So we have a team, a psychologist team, that we can go to different units and do debriefings, because it does need a real support and structure to it. We are actually strengthening the programs right now, because we believe that as the numbers continue, and they will stay down, because you're going to get us vaccines and we're going to get them in arms. As we see that wave go down, I anticipate this next 6 months will have a lot of need for our emotional support, not only with our caregivers, but with our whole community.
Thank you so much. And I think on that note, we might leave it there for today. We do have a few more questions, but given the timing, I think we might end it there. Before I throw back to Ambassador for some last minute farewells, I'd just like to point out, for those who aren't aware, our friends at the Pacific Forum are also hosting a webinar this afternoon, and it's in partnership with the US Indo-Pacific Command. So if you weren't aware and want to continue that conversation, the Pacific Forum are also having their event this afternoon.
Thank you, Gabby. Now, I want to thank everyone. First of all, though, before we finish off, First Lady Dawn Amano-Ige, my very wonderful co-host, do you have any last comments to make?
Yes, thank you. I just want to thank everybody for being part of this panel and this discussion today. I think we came off learning so much. We've learned, we are grateful for so many things that you have all done and you have all shared. We are inspired, and we also know that there is much more work to be done ahead. So as a group today, I think we can go back knowing that if collaboration is a strength that we have in Hawaii, Australia, and around the world, that we need to work together to face the future and to come together to resolve and to address many of the challenges ahead. And I want to thank Ambassador Hardy and Gabby for all your work in putting this together. I think we always look forward, as I said, to International Women's Day because it gives us a chance to share and exchange ideas. So thank you and aloha and mahalo to all of you.
Mahalo to you, Dawn. Mahalo to our wonderful panelists, Dr. Libby Char, Dr. Jill Green, Nurse Charlene Pang, Ms. Kathy Ross, and Dr. Joleen Darby. And thanks especially to Gabby, who didn't want to be on the screen, but I've made her come around. A special thanks to my assistant, Chrissy Fisher, who's put a lot of this together with Gabby. Chrissy's just rushed off because she's going to go to the Big Island and swim with the manta rays. It's her birthday today. She's already gone, but I reckon that's a great thing to do. Come to Hawaii or be in Hawaii and just go and do these wonderful things that we have on our doorstep. I also want to thank Bill Rudge, our consular officer, who's been working with us, and all our office champions, including our blokes. Our blokes are wonderful and they are our champions as well. And I just want to quickly comment that I asked specifically for music by our own Hawaii ukulele virtuoso, Taimani Gardner. So I don't know if you realised, but on our video, her music was playing. So kudos all around. Thank you, everybody, and we hope to see you in person next time here in Hawaii for International Women's Day. Aloha, aloha.
Thank you.